My name is Beth Cotsey and I'm the Executive Director of Mental Health Services. I'm absolutely thrilled to support the nomination by the Chief Executive and the Executive Director of Nursing and Midwifery and Clinical Governance of Beck for this award. It is really well deserved. Beck is one of those rare and special people who really make the system work. She promotes a very positive culture of patient-centred care. She's always very concerned for patients' rights, dignity. She embodies a compassionate, caring attitude towards patients and providing patients with the very best assistance in their recovery journey. She's an outstanding leader within the mental health service.
Hi, I'm Beck Sherriff and I'm the Nurse Unit Manager for Urella at Cumberland Hospital, which is our intensive care unit across the Western Sydney LHD for mental health. I've been nursing for 17 years and I've been in Urella for the last 15 months. I started February 2016 there. Over that time, there's been some significant changes in the unit, which we're really proud of, and I am as the manager of the unit. One of those has been a massive change in the culture of the unit and how the team works together. We've gone back to the focus being the patient and patient-centred care and how we can incorporate patients into their planning and treatment. One of the upsides of that is that the staff have felt more empowered to be able to do that and to give the patients a voice, and we've actually seen a reduction in our seclusion and restraints over that 15-month period. We're continuing to build on that, and we're building on that with a quality improvement project at the moment around seclusion and restraint, and part of that has now started since February this year. We're getting together each week and we're doing a review of any seclusion and restraints that have occurred through that period of time, each week to week, and we look at the IMs that come through that are put in by staff. We're looking at the electronic medical records, and when we do that, we're then having conversations around the patient from the admission through to that time where a seclusion or restraint might have occurred. And recently, over the last month or 2 months, we saw a dramatic decrease where we went for, I think, 21 days with only one seclusion that happened in between that time, which was a very big improvement for us and one we're very proud of. Second phase of this quality improvement is once we get it up and running and we're sure that the process is working, we'd actually like to get the patients involved in this weekly meeting as well. So some of the other changes that we've seen over the last probably 18 months is that we had a dedicated consultant psychiatrist be employed onto our unit, which previously we didn't have. That's made a big change, and we've had a registrar also allocated to our unit. We've been able to now establish a really robust team that is there and is constantly accessible for our patients. So there's some of the things that we're proud of.